Radiotherapy has been used to treat cancer for over 100 years, so it's not a new treatment. It uses X-rays to injure or kill the cancer cells. Because cancer cells are multiplying or increasing in number, they are more sensitive to the effects of radiation. The machines that we have available nowadays to deliver radiation are very, very precise, and we can target the cancer very accurately. This means that we can give a high dose to the cancer but keep the dose to the surrounding normal tissues to a minimum.
I had a radiotherapy after the surgery, firstly because they took out all the lymph glands around the affected area and they found some cancer cells in one of them. And so they said, well, we better just zap this and deal with it.
And we often combine it with chemotherapy given simultaneously because we find it's much more effective that way.
I breathed through the radiation. It was the chemo that really knocked me around.
Oh, it was very difficult. I think perhaps that's the hardest part. As I say, I was away on the farm. I certainly got lots of friends, but they're all out and at distance. And I really didn't feel like having visitors much. I was so tired and I was still in a great deal of pain with the radiation burning. And I think I was taking a lot of drugs and I was sleepy. But gradually, I came back and gradually I built up my strength.
I went for the first couple and he said, look, don't come, this is fine. You know, he just whizzed in and out. So I thought, well, this is going to be all right. But I think about the third week, he started to get very sore, and by the end of it, it was awful for both of us because even water going down was clearly agony.
People having radiotherapy to the chest can experience a side effect known as esophagitis. This is inflammation of the lining of the esophagus, which causes pain when you're swallowing food and drink. The reason we'd like to get on top of this early is we don't want you losing weight or becoming dehydrated.
That went on twice a day, that radiation, and at the time there's no discomfort at all, of course. It's not until 6 weeks later that the pain starts and the burn starts. Of course, I think that depends where you have your radiation, and mine was through the esophagus here, and of course it burnt that and it was just so painful and I couldn't eat anything.
For patients who are having treatment over a period of weeks, say 6 weeks, most patients will get some degree of fatigue and tiredness. These symptoms occur because the lining cells of the skin and of the gullet are multiplying like the cancer is, and so they are susceptible to the damaging effects of radiation. However, the body has learned how to heal itself. As you know, when you cut yourself or you burn yourself, the body repairs the injury, and so it is with any damage done by the radiation. The cancer, of course, is not like the normal body, and it doesn't have this capacity for healing itself, and so the effect of radiation is much more permanent on the cancer than it is on the normal tissues.
But I have to say that once the treatment finished, the lining grew back on my esophagus quite quickly in about 4 or 5 or 6 days, and I was able to start eating a bit again and get my strength back up again, and it actually improved quite quickly.
I can imagine is radiotherapy like the jet fighter bomb right in the lung is the enemy base, and the chemotherapy like you use the Navy to send all the ship in your bloodstream to waiting for the cancer cell. They run away from the base and they kill all.